So,
Here?
for my... Oh, go. Yeah. So, my name is Abe Port. I'm a member of the shul. You don't see me here too much on Shabbos because we moved away to Hillcrest about 20 years ago, but we still keep our affiliation with the shul, still our home. Many of the people in the shul, their sons and daughters were ultrasounded by me when they were in utero. Now they're married with children of their own. So I was one of the people that used to do the ultrasounds. But what I'm going to talk today a little bit about is some developments in breast work, and in particular something which I had a little handout. In August, Governor Cuomo signed into law, which took place January of 2013, a law discussing breast tissue density. And it may sound like an esoteric phenomenon, but it's something to be talked about. Most people know the standard of care today is a woman should, over 40 should be getting a mammogram once a year. We know over the past 20, 30 years that mammography as a test, and this is an example of a mammogram, we take generally two pictures. We take a picture in an oblique projection, which tries to get a lot of the breast from the bottom of the breast going up into the armpit, and we take another picture in the opposite direction. So one picture is taken from side to side, one picture is taken from up and down. But there are limitations of the sensitivity of the mammogram. And all of us have people that we know had a mammogram. I don't understand. 2 months later, she felt a lump. She went in. There was a breast cancer. How come the mammogram didn't find the breast cancer? And the answer has to do with what was called the breast density. To give you an example of what density of breast is, I'll give you the example that I use when I speak to people and patients. It's the following. If you take a picture of a tree, and I tell you the tree looks normal, there's no broken branches, there's nothing growing on the tree, everything is fine. But there's a very big difference if you take the picture of the tree in February or you take a picture of that tree in August. Because in August, there are so many leaves, it's very lush, it's great, but can we really see what's on the tree? The answer is we can't see what's on the tree because the branches are being hidden by the leaves. In February, if a branch is broken, if there's a squirrel, if there's a nest, you see it immediately. So the dense breast is the breast which we call the August tree breast. The non-dense breast is the breast of the February breast. So let's move on to the slide. Okay, this is an example of a breast which is not very, very dense. You see through the dense. You can see this little nodule here very easily. The breast is made up, of the glandular tissue. Water, please. The breast is made up of the glandular tissue, the breast tissue that makes the milk, the ducts, the blood vessels, and everything else like that. Okay? And the gray area, which is called fat. Now, some breasts are fatter than others. It has nothing to do with the size of the breast. It has to do with its internal structure. Move down another couple slides. Keep going. More. Keep going. This is an MRI we'll go afterwards. Keep going. Sorry that it's a little bit out of order. I can't see all of the things, or I will tell you which one to point to. As you can see, there are different densities in the breast. So keep going. More. You can put up the. Yeah. Then at least I can tell you which one to point, which one to do. Okay. Keep going now. Okay. This is not the.
Might be the end.
So, yeah. Anyhow, so as you can see, there are different densities of breast tissue, and so you can't see anything through the dense breast. And this is not a breast, this is actually a specimen after surgery in which a breast cancer was taken out, and this was a marker that was put in during the breast biopsy. So breast tissue has different densities, and breast tissue has different. Are you sure there's not more than one on the zip drive? There was a couple of. This was a zip drive, and there were other things in there. You could keep going down because this is not. See, wait.
This one?
Yeah, that's the one. You put the wrong one. Back, you see? Okay, now you're going back? Aye. Go back. Okay. So here, did you see the breast? Do you see how dense the breast is? It's very hard to see through it. Okay. Now, put this picture on number 8. Okay. Do you see the difference? This is the February tree breast. Go back. This is the August tree breast. You can just by looking at it say how much less sensitive this is than this one, right? Here you see everything you need to see. Here you don't. So, the problem was over the last 20 years or so, people said, I don't understand why we're missing the breast cancers. New York State became the 4th state in the United States to say when a woman leaves her mammographic experience, she's to be told how dense her breast tissue is. Because if she's told, then she understands how sensitive or not sensitive her mammographic experience was. There are studies, some of which are statistical, games and things like that, that says the denser the breast tissue are, the more at risk you are for breast cancer. It's not just that the radiologist will miss the breast cancer here, but in fact, because you have more breast tissue per cubic inch of breast, you have a higher risk for breast cancer. So this is dense. So how do you overcome this? So the answer that we talk about in overcoming it, one of the answers is ultrasound. So ultrasound, the same ultrasound that you use for looking at babies, the same ultrasound you look at looking for hearts, the same ultrasound that you use for looking at thyroids, the same ultrasound that you use for looking at gallbladders, you can use for breast tissue. Keep going down. So as you can see, there's lots of different kinds of breast tissue, breast densities. Keep going down. Stop, go back. Now, this is an example of a breast cancer as seen on ultrasound that would be buried in the dense breast tissue of the dense breast. That might be seen. Now this, as Mel will tell you, well, this one I probably can feel. And he's right. This is a palpable one. But a woman who had a mammogram 5 years ago, when this was a tiny little cancer, move down, like this, okay, was not be seen until you felt it in a dense breast. And as a matter of fact, the patient that I'm talking about, this was a breast cancer, go back one, in the same patient that had this palpable breast cancer. This breast cancer was in the inside of the breast, upper inner part of the breast. Next. This breast cancer was on the outside of the breast. Found only on ultrasound in the dense breast. What's the implication? Well, go back one. If a person has one mass in the breast, they go and they have a lumpectomy, and they could be cured. In today's world, women who have screening mammography and physical examination and ultrasound in the dense breast tissue, who are just going through the routine, not the one that feels the lump in her breast, not the one who's not going for her annual checkups. The cure rate is well over 90%. I'm talking about the cure. They will not have breast cancer again. That's tremendous. When I started working in breast cancer in 1975 at Sloan Kettering, at 10 years, if the number was 25%, what they used to call the salvage rate. They meant in 1975, 75% of women who had had breast cancer did not live 10 years. Today we're 90% cure, 95% cure. Okay, why? So this woman would go and have a lumpectomy. And what would be missed, go next slide again, is this small little cancer in a different place in the breast. Because the mammogram didn't show it, you didn't feel it. But now, we see this, we biopsy it. She has 2 different breast cancers in the same breast in different locations. This woman is not a candidate for lumpectomy. She needs a mastectomy. But with her mastectomy, she's not cured. So you went from someone who had a lump, could have had a lumpectomy, and 3 years later, we believe have a recurrence. But it wasn't a recurrence. It was just a breast cancer that was undetected because the breasts were dense and we didn't do the other tests to find out that there's something else. Also, MRI is very, very, very helpful. So again, go back to this picture. Right? Very dense breast. We're going to miss breast cancers here. It's not that this doesn't show certain kinds of breast cancer, but in this density, you're not going to see it. As opposed to the other breast that we showed before. I have to go one by one. Right, even this breast, go back. You see how fatty this breast is. The dark tissue is fat. You're not going to miss the breast cancer in this one as much. So this person wouldn't necessarily have. Now, if you really want to know what these are, okay, Mark was telling you about iodine, which is a metal, which is calcium. These are calcium deposits in this breast. This breast had had some trauma, car injury, seatbelt injury, and the fat within the tissue hardened and became calcified. So this is traumatic calcifications, but that's not important. But I want people to understand that the sensitivity of the mammogram is very much dependent on the density, and now every woman, when she goes to her mammographic experience, is to be told by her doctor how dense her breasts are, and if the breasts are in fact dense, she should be getting other tests, such as ultrasound.